Your medicine cabinet might be stealing your memories. I'm not kidding. There are 6 types of medication sitting in homes right now that can make your brain foggy, confused, and forgetful. And chances are, you or someone you love is taking at least one of them. Stay until the end because I'll show you what to do about it. Before we start, I need to say something super important. Never ever stop taking your medications without talking to your doctor first. Stopping suddenly can be very dangerous. This video is to help you have better conversations with your doctor. It's information, not medical advice. Always talk to your healthcare provider before making any changes, okay? Good. Now let's talk about these 6 medications and what you can do about them. Some of the most common medications that people take every single day can actually make your memory worse. They can make you forget names, lose your keys, or feel confused. And the really tricky part? Most people have no idea their medication is causing the problem. They think they're just getting older. But it's not always age. Sometimes it's the pills. Today, I'm going to show you 6 types of medications that can affect your memory, especially if you're over 65. And more importantly, I'll tell you what safer options you can talk to your doctor about. But first, let's understand why seniors are affected more than younger people. Imagine your body is like a house with pipes. When you're young, water flows through those pipes quickly. But as you get older, those pipes slow down a little bit. It's the same with medications. When you're younger, your body processes medicine quickly and gets rid of it fast. But after 65, your body takes longer to clean out medications. Think of it like this. If you pour water into a sink with a slow drain, the water sits there longer, right? Medications work the same way in your body. They stay around longer, which means they have more time to cause side effects. Plus, many seniors take multiple medications, maybe one for blood pressure, one for cholesterol, one for sleep, and one for pain. All those medications are mixing together in your body like ingredients in a soup. Sometimes they don't mix well. This is why a medication that was perfectly fine when you were 50 might cause problems when you're 70. Your body just processes it differently now. So, which medications are the biggest problem? Let's start with the first 2. The first group has a big scary name, anticholinergics. But don't worry about the name. Just know they're in a lot of common medications. Allergy medicines. Have you ever taken Benadryl? That's the most famous one. The ingredient is called diphenhydramine. It's in many allergy pills and it makes you sleepy. Sleep aids. Look at any medication that says PM on it, like Tylenol PM or Advil PM. Those usually have the same sleepy ingredient. Here's the problem. These medications work by blocking signals in your brain. They're like putting tape over your mouth. They stop certain messages from getting through. In young people, this isn't usually a big deal. But in seniors, blocking these brain signals can cause confusion, forgetfulness, difficulty concentrating, feeling foggy. And here's what most people don't know. Anticholinergics aren't just in allergy pills. They're also in medications for an overactive bladder, some stomach medications, and even some muscle relaxers. Studies show that seniors who take these medications regularly have a higher risk of memory problems. Some studies even link them to dementia if used for many years. But don't panic. There are better options, and I'll tell you about them soon. First, let's talk about medication number 3. These are medications for anxiety and sleep. You might know them by names like Xanax Valium, Ativan, Klonopin. These medications work by slowing down your brain. Think of your brain like a busy highway with cars zooming around. These pills make all the cars slow down. For someone having a panic attack, that can be helpful. But the problem is, when your brain slows down too much, everything slows down, including your memory. For seniors, these medications are extra risky because they stay in the body much longer. They increase fall risk because they make you dizzy. They can cause confusion that looks like dementia. They're hard to stop once you've been taking them for a while. Many doctors are now trying to avoid prescribing these to seniors because the risks are so high. There are often safer options for anxiety and sleep. But wait, even medications for your heart can sometimes affect your memory. Let's talk about that next. Statins are medications that lower cholesterol. Millions of people take them, and for most people, they work great with no problems. The common ones are atorvastatin, Lipitor, simvastatin, Zocor, rosuvastatin, Crestor. Now here's the important part. Not everyone gets memory problems from statins. Most people don't. But some people do experience trouble remembering words, feeling mentally fuzzy, confusion. Scientists aren't completely sure why this happens to some people and not others. It might be about how your specific body processes the medication. If you're taking a statin and feeling foggy, don't just stop taking it. Statins prevent heart attacks and strokes, which are very serious. Instead, talk to your doctor. Sometimes switching to a different statin helps. Sometimes adjusting the dose helps. Sometimes taking it at a different time of day makes a difference. Now let's talk about the last two types of medications that can affect your memory. Blood pressure medications. Some older blood pressure medications can cause mental fogginess. The ones most likely to cause problems are called beta blockers. They're still good medications, but newer options might work better for some seniors. Antidepressants. Older antidepressants, especially ones called tricyclic antidepressants, can affect memory. These include medications like amitriptyline. Newer antidepressants usually cause fewer memory problems. Overactive bladder medications. Remember anticholinergics we talked about earlier? Many bladder control medications are in this group. They include oxybutynin, ditropan, tolterodine, to Detrol. These can really affect memory and thinking in seniors. So now you're probably wondering, what can I do instead? Let's talk about the safer alternatives you can discuss with your doctor. Remember, you must talk to your doctor before making any changes, but here are alternatives to ask about. For allergies, instead of Benadryl, ask about newer antihistamines like loratadine, Claritin, cetirizine, Zyrtec, fexofenadine, Allegra. These don't cross into your brain as much, so they cause less fogginess. For sleep, instead of sleeping pills with anticholinergics, try melatonin, natural hormone, better sleep habits, dark room, cool temperature, no screens. Cognitive behavioral therapy for insomnia. For anxiety, instead of benzodiazepines, ask about buspirone, non-addictive anxiety medication, SSRIs, like sertraline or escitalopram, therapy or counseling relaxation techniques. For cholesterol, if your statin is causing problems, ask about switching to a different statin, adjusting your dose, taking it at a different time, adding other cholesterol medications instead. For bladder control, newer medications like mirabegron, Myrbetriq work differently and might cause fewer memory problems. The key is, don't suffer in silence. If you think a medication is affecting your memory, speak up. Here's your action plan. Step 1, make a list. Write down every medication you take, prescription and over-the-counter. Include vitamins and supplements too. Step 2, check the labels. Look for the ingredient names I mentioned. Don't just look at the brand name. Check the actual ingredients. Step 3, schedule an appointment. Call your doctor or pharmacist. Say something like, I'd like to review my medications because I'm concerned about memory side effects. Step 4, ask these questions. Could any of my medications affect my memory? Are there safer alternatives we could try? What should I watch for? How long before I notice improvement if we switch? Step 5, be patient. Some medications need to be stopped slowly. It might take weeks to switch safely. Don't rush it. So there you have it. 6 types of medications that can affect memory in seniors and what you can do about it. If this video helped you, Give it a thumbs up and share it with someone who needs to hear this. Maybe a parent, grandparent, or friend. And remember, you are your own best advocate. Don't be afraid to ask questions about your medications. See you in the next video, and stay healthy.